Now let's talk about the muscles which are present in the scalp. So we have only one skeletal muscle which is in the scalp. This is the occipitofrontalis muscle. When the occipitofrontalis muscle contracts, the first three layers of the skin will move together as a unit. These layers are the skin, connective tissue, and the aponeurosis. The fourth layer, which is a loose areolar tissue, is going to allow the aponeurosis to move on the periosteum. So that is the significance of the fourth layer. Okay, now let's talk about the action of the frontal bellies of the occipitofrontalis muscle. The action of the frontal bellies of the occipitofrontalis muscle is that it can raise eyebrows to show surprise or horror. Okay, so this is basically the function of the frontal bellies of the occipitofrontalis muscle. Now let's talk about the nerve supply of the scalp. So I have a mnemonic for you guys, and that is SSAZO. Okay, so S for supratrochlear nerve, and another S for supraorbital nerve, A for auriculotemporal nerve, Z for zygomaticotemporal nerve, and O for the occipital nerve. Occipital nerve is further divided into greater and lesser occipital nerves. So S, or the supratrochlear nerve, is a division of the ophthalmic nerve. The supraorbital nerve is also a division of the ophthalmic nerve. And the auriculotemporal nerve is a division of the mandibular branch of the trigeminal nerve, which is the third cranial nerve. And the zygomaticotemporal nerve is a division of the maxillary division of the trigeminal nerve. And occipital nerve is from the cervical plexus. So now let's talk about the supply of these nerves. So the supratrochlear nerve is going to supply the vertex of the skull and the median plane of the scalp. And the supraorbital nerve is going to supply the vertex as well. It is going to extend towards the vertex, and it is going to supply the forehead. And the auriculotemporal nerve is going to supply the temporal region. The zygomaticotemporal nerve is going to supply the scalp over to the temple. Auriculotemporal nerve is going to extend from the auricle towards the side of the head, and it is going to supply the temporal area. And now let's talk about the occipital nerves. So lesser occipital nerve is going to supply the sternocleidomastoid muscle, the posterior edge of that, and the lateral part of the occipital region and the medial surface of the auricle. You can just remember the sternocleidomastoid and the medial surface of the auricle. These are the most important things. Now let's talk about the greater occipital nerve and what it supplies. It is basically the posterior ramus of the C2 nerve, and it is going to supply the back of the scalp and the skin as far as the vertex. So vertex को कौन सी nerve supply करती हैं? First of all, we have the supratrochlear nerve, the supraorbital, and the greater occipital nerve. And forehead को कौन supply करता है? Supraorbital nerve. And temporal region को auriculotemporal and zygomaticotemporal nerve. So basically, if we move laterally to the midline, we are going to see a connective tissue layer. So basically, the connective tissue layer will follow the nerves, and it will form an anastomosic network. I have a mnemonic for you guys, that is SSSOP, like soap. Okay, so from soap you can remember the arterial supply of the scalp. So first of all, we have the supratrochlear artery, then we have supraorbital artery, then we have the superficial temporal artery, and then the occipital artery, and then the posterior auricular artery. So can you guess what are these branches of? Basically, the supratrochlear artery is a branch of the ophthalmic division of the internal carotid artery. Supraorbital artery is also a division of the ophthalmic division of the internal carotid artery, and the superficial temporal artery is the smaller branch of the external carotid artery. Occipital artery is also division of the external carotid artery. Posterior auricular artery is also a division of the external carotid artery. So basically, all the arteries of the scalp are derived from either the internal carotid artery or the external carotid arteries. What these arteries will supply? Supratrochlear and the supraorbital arteries are going to supply the forehead along with the associated nerves. What are the associated nerves? Supratrochlear and supraorbital nerves. Now let's talk about the superficial temporal artery. Okay, so superficial temporal artery is going to supply the auricle. It is basically in front of the auricle, and it is going to be along with the auriculotemporal nerve. This is something that you gotta remember. And it is going to divide into anterior posterior divisions, and it will supply the frontal and the temporal regions. Frontal यानी कि anteriorly, एंड टेम्पोरल यानी कि लैटरली। ऑक्सीपिटल आर्टरी जो है ना वो एपेक्स ऑफ द पोस्टीरियर ट्रायंगल से राइज करेगी एंड along with the nerves it is going to pierce the trapezius muscle and it is going to supply the scalp and ये जाएगी towards the back of the scalp up to the vertex। अब हम बात करते हैं posterior auricular artery की। posterior auricular artery behind the auricle and above the auricle को supply करेगी। ओके सो बेसिकली अगर हम देखें कि किस तरह से सप्लाई करती है, सो आई एम गोना मेक इट विद यू गाइस। अच्छा सो सबसे पहले हम लोग बनाते हैं स्कैल्प का स्ट्रक्चर, ठीक है। नाउ अब मैं नोज बनाने लगूंगी। राइट, अब मैं एक मिड लाइन डिवीजन बनाऊंगी जस्ट फॉर ईज। ओके, अब मेरे पास एक येलो पेन है, इससे मैं जो है ना बनाने लगी हूँ सुप्रा ट्रोक्लियर डिवीजन, ठीक है। अच्छा, अब मैं बनाने लगी हूँ सुप्रा ऑर्बिटल डिवीजन। अब मैं बनाने लगी हूँ ज़ाइगोमैटिको टेम्पोरल डिवीजन, यानी कि नर्व्स की बात करी। अच्छा, उसके बाद मैं बनाने लगी हूँ लेसर ऑक्सीपिटल नर्व, जो कि होगी यहाँ पर, यहाँ पे होगी ग्रेटर ऑरिकुलर नर्व। अब मैं यहाँ पे ईयर्स बनाऊंगी, ठीक है। नाउ अब ये जो है ना ये सप्लाई करेगी ऑरिकुलर टेम्पोरल नर्व है ये। ओके, अब हम आर्टरीज को बनाने लगे हैं। अब हम बनाने लगे सुप्रा ट्रोक्लियर आर्टरी, ठीक है। अब ये जो है ना आपने इसको बहुत ज्यादा यू हैव टू मेक इट लाइक अ प्लेक्सस कनेक्टेड होनी चाहिए बहुत ज्यादा आर्टरीज। दैट वाज नॉट द केस इन केस ऑफ वेन्स। सुप्रा ट्रोक्लियर आर्टरी एंड सुप्रा ऑर्बिटल आर्टरी हो गई, ठीक है। नाउ ये है हमारे पास जाइगोमैटिक और टेम्पोरल आर्टरी। अभी पोस्टीरियर ऑरिकुलर आर्टरी भी मैं बनाने लगी, जो कि ईयर के बिल्कुल पीछे हो गई। So basically that was. So now let's talk about the venous supply of the scalp. So first of all, I have these mnemonics for you guys. First mnemonic is SSF. So for the supratrochlear and the supraorbital veins, they are going to unite and they are going to form the facial vein. That was for SSF. Now I have another mnemonic. That was SRM. So for the superficial temporal vein and the maxillary vein, they are going to unite to form the retromandibular vein. Third venous connection is that of the posterior auricular vein and the posterior division of the retromandibular vein. It is going to form the external jugular vein, EJV. So the mnemonic for this is going to be PPEJV. So SSF, ASMR, PPEJV and occipital vein जो है ना वो occipital venous plexus को supply करेगा. This lies beneath the floor of the posterior triangle and vertebral veins को supply करेगा जो कि internal jugular vein को supply करेगा. So internal jugular vein को कौन supply कर रहा है? Occipital vein. External jugular vein को कौन supply कर रहा है? Posterior auricular vein and the posterior division of the retromandibular vein. ये external jugular vein को supply करेगा. Now let's talk about the lymph nodes of the scalp. अच्छा, सबसे पहले anterior part of the scalp and the forehead. अब ये जो है ना इनको supply करते हैं submandibular lymph nodes. The lateral part of the scalp above the ear is going to be supplied by the preauricular lymph nodes or the superficial parotid lymph nodes. Above and behind ears, we have the mastoid nodes. And back of the scalp, we have occipital nodes.